Today, local healthcare professionals, law enforcement, and elected leaders gather to take on the question, how do we take on the opioid epidemic? WENY's Samantha Potter was at the seminar to learn about their plan to treat opioid addiction in the Southern Tier. Samantha?
Renata, at today's seminar, almost everyone could agree you can't arrest enough people to solve the problem, which is why leaders are looking at other solutions to putting a stop to the opioid epidemic. How to put the pill back into the bottle. That was the question medical professionals, law enforcement, substance abuse treatment centers, and elected leaders asked themselves today at a seminar sponsored by Arnett Health.
Recently, more than ever, I've had people come to me and say, I need help.
But how to help them and those not asking for help is the question. Recently, New York State has put limits on an initial prescription from a doctor to no more than 7 days worth of medicine. That way, unused pills aren't floating around in medicine cabinets and the chance of addiction decreases.
It is difficult for some patients to understand why wouldn't we be more liberal with treating them for pain, but if we talk to them about the guidelines that came out recently from the CDC and talk to them about the alternatives for treating their pain, I think they're a lot more understanding.
For the most part, there are other drugs that are less addictive and less dangerous that can be used. And I think the intent is to encourage doctors to look towards other ways to manage chronic pain.
Other legislation includes Narcan, a drug used to reverse the effects of an opioid overdose, to now be covered by health insurance. Senator Tom O'Mara says they're also working with law enforcement and lawmakers to create harsher punishments for dealers.
With the increase in the use of fentanyl as a mixing component in that drug, to be able to go after the dealer for a homicide charge for selling that drug to an individual that ultimately dies from an overdose from it.
Captain Sean Hawley of the Chemung County Sheriff's Office says law enforcement is still in the early stages of figuring out how to tackle the problem on their end.
Law enforcement is starting to look at different ways to approach this, and for the first time I think we're doing that. It's kind of like when the methamphetamine epidemic hit us in 2006. We as law enforcement really didn't know how to deal with that.
Everyone at the seminar could agree it's going to take collaborative efforts from the whole community to make it easier for those addicted to get the help and recovery they need, and then in the long term put an end to the opioid epidemic. Reporting in the studio, Samantha Potter, WENY News.